Hello, everybody. Let me introduce my thesis topic, investigating the accuracy of artificial intelligence used for caries diagnostic. My name is Bruna, I'm a dentist, and my supervisor is Martin Kivovic, and my SMS is Alex. My vision is making high-end dental diagnostics accessible to the public, and my mission is applying artificial intelligence for community dentistry. And here you can see my specific goals. The first one is investigating the accuracy of the artificial intelligence used for approximal caries diagnostic. And the second one is investigating the accuracy of intraoral scanners used for approximal caries diagnostic. And in the first one, we are going to perform a systematic review and a meta-analysis. And according to our background, the direct cost of dental caries is more than $200 billion a year. And considering caries, and caries still affecting 60 to 90% of people population, especially approximal caries. And considering biting radiography as standard, to have a good accuracy can reduce 62% of the complex cases and save more than 100 billion teeth. And as you can see on the images, it's not very easy to check them at the first look. And in addition, the literature shows disagreement between experts about caries diagnosis on biting radiographies with a sensitivity range between 0.5 and 0.7. On the other hand, artificial intelligence diagnosis of dental caries can enhance the early detection with a sensitivity ratio of 85. So our aim is investigating the diagnostic accuracy of artificial intelligence for approximal caries lesions on biting radiographies. Here you can see our clinical question: what's the accuracy of artificial intelligence used for approximal caries diagnostic on biting radiography? You also can see our PERD and our hypothesis with the clinical implication that artificial intelligence can increase dentist's diagnostic accuracy, especially enamel lesions, and avoid the teeth lost. Here you can see our systematic search in each domain, and we choose biting for the first domain, and caries and their related words for the second domain. Now we are going to talk about our three key articles that compare the diagnostic performed by artificial intelligence to experts. And the strengths of the first key article were the deep learning efficiency and the huge caries classification that they adopted. The limitations were the tooth overlap in biting radiographies that can reduce the precision and the trueness of artificial intelligence caries detection, and the small training sample size. In the second one, the strengths were the deep learning efficiency as well, and the sample randomization. And the study showed that the outcomes characterize artificial intelligence impact in dentistry, and as limitations, the experts weren't randomized, and they used a limited sample and number of experts. In the third one, the strengths were the potential impact of artificial intelligence in dentistry. They used a validated model, and the limitations were they used only one deep learning model in the test, and they used a limited number of experts, and the study does not reflect all aspects to decision making. Here you can see the number of articles in each step. Now we are working on the full text selection. And in our second project, we are going to perform a systematic review and a meta-analysis as well. And according to our background, more than 500 million children have untreated dental caries in primary teeth in the world, and the introduction of intraoral scanners in caries diagnosis can support the clinical decision and saved more than 100 billion teeth. And the expert starts scanning the patient teeth, And where there is demineralized tissue, there is more water, and the water reflects the infrared light of the intraoral scanner, resulting in a bright area with the shape of the lesion. That's why intraoral scanners can result in equal or improve the sensitivity in comparison to bite-wing radiographies, as we can see in the numbers. So our aim is investigating the diagnostic accuracy of intraoral scanners of approximal caries lesions. In our clinical question, what is the accuracy of intraoral scanners used for caries diagnosis? You can see our PERD and also our hypothesis with a similar clinical implication that intraoral scanners can increase dentist's diagnostic accuracy and avoid the teeth lost. Here you can see our preliminary search key. In the first domain, you used our index test, intraoral scanner, and its commercial names. And in the second domain, we used caries and their related words. And we chose 3 in vitro articles that used permanent teeth mounted in a base to compare some types of caries diagnostic, including bite-wing radiographies and intraoral scanners, to histological assessment and micro-CT. And as outcomes, they included sensitivity, specificity, positive and negative predictive values, and others. Here you can see our summary with planned submission date for June of next year for the first project and September of next year for the second project. And to finish my presentation, I would like to use a Paulo Freire quote that says, "Education is an act of love and therefore an act of courage, and you cannot fear the debate, the reality analysis. You can't escape the creative discussion, otherwise it will be a phrase." Thank you for your attention.
Do you know what type of artificial intelligence architecture did they use in those articles? Is there any data about it?
Thank you for your question. Yes, they used to use deep learning models because they can learn and execute the tasks alone without our supervision.
What qualifies an abstract? Is it like the number of training models, or like what do you see to select an abstract in this your own AI topic?
Yes, actually they sometimes compare the artificial intelligence for an existing reference test, for example, bite-wing radiographies in our case, and sometimes they validated the model, so we can consider it like a secondary outcome.
I have seen by your research question slide that you are looking for multiple intraoral scanners. And my question is, do you plan to do a subgrouping based on the system and the software used, or you just want to pull together all the intraoral scanners?
Thank you for your question, Adam. For now, we are working on the feasibility of the topic, so we are going to thinking about that when we have more details about the search and the feasibility. Thank you.
Is it common to have these scanners at dentistries, or maybe are they used for another goal?
Yes. Thank you for your question. Yes, the scanners are mostly used to scan mouth, for example, for print ceramic crowns and occlusal splints. But some models have a tool of caries diagnostic, and now we can test them if they are good or not, if they are effective or not, and compare with index of reference tests.
There is no more question. I just want to ask something for the second project. Is it in vitro or clinical study?
It's in vitro.
In vitro, okay. But that makes sense because if the radiological sensitivity or accuracy is lower than the intraoral scanner, what would be the reference? But in vitro, you can use tissue histology or macroscopic.
Yes, in the second project, we are going to use the extracted teeth as population. So we are considering that histological assessment is a reference test. So that's why it's an in vitro study.
Okay, and then just one comment that in Szentkirály 47, at least I know 2 departments which has an intraoral scanner with caries detector, so you can even do a clinical trial. We are very appreciated to join. And just one thing at the first project, that the limitation was the low sample size, which could be one of the reasons why you make meta-analysis in normal way, but in this special situation, it's not really good because the sample size is not required to get some significant result. The sample size required to learn, to teach the artificial intelligence. So if the sample size is low, you could have a very so-called over-parameterized method. So it's because in meta-analysis you cannot compare or validate of one study's result with the other study's result because you don't have the raw data.
Yes, thank you.